tell me a little bit how your career starts.
So I left. So when I came out of grad school, I joined HP. Didn't want to go back to Wall Street. Decided to go work for HP in Boise, Idaho. And I picked Boise because at that point I was 28 when I graduated from Duke, and I looked at it: 200,000 people, 21 golf courses. It's Idaho. Let's go and hang out in Boise for a couple of years. And so I did that with HP. Moved to the Bay in '99. Worked for HP down here. And then I had aortic aneurysm when I was 29.
What was that? I'm sorry.
I had an aortic aneurysm when I was 29.
Aneurysm,
So
okay.
I had open heart surgery and lung surgery. He's going to come and walk.
It's okay. No, it's no worries. That's actually pretty good.
I had an aortic aneurysm when I was 29. I ended up at UCSF, heart surgery, lung surgery for a while, and then ended up coming out of that and kind of deciding, what do I want to do? I was working for a startup before then. Had a friend of mine who was in healthcare and said, "Hey, we have an early stage startup that does medical imaging packs. Do you want to be part of it?" I said, "Sure." And that's what got me into healthcare, right? I figured I was kind of focused on healthcare through my surgery, and ended up joining a medical imaging packs company, and then I've stayed in healthcare ever since.
And in what capacity were you serving in the healthcare industry?
So initially we were doing medical imaging packs in the healthcare space. I did everything from sales to sales ops to biz dev and so on and so forth. And then I ended up leaving that startup after we ended up selling that company to Philips in 2005. I ended up running all of Asia and Latin America on the informatics side for Philips. I was traveling to Asia, to Latin America, and kind of that whole combination. And then ended up leaving because the travel was getting too crazy. And so I ended up doing another startup and kind of advising another startup. And then I had a lot of investors and advisors telling me, if you really want to understand healthcare, go work in a hospital for a while. And so I had a friend of mine who was CIO at Stanford and said, "Listen, you need somebody to come and drive strategy and growth for our IT organization." And so I ended up joining Stanford, running all their Community Connect, Epic growth for the hospital. I really understood how hospitals think and how hospitals do things and how hospitals work, and decided about 4 years into that if I either stayed at Stanford, I'd be there for the rest of my career, or if I left, I could do other stuff. So I decided to leave, consult for a while, and consulted for healthcare companies doing, big data, machine learning, AI, clinical insights, and so on and so forth. And then in 2018 was recruited at Varian Medical Systems on the oncology side to help build a managed services business for the cancer business for Varian. And then did that before I started WiTT.
Okay. Yeah. So then what was the catalyst to go from working, specifically like in this latest, role, working in oncology, leading that strategy, to then deciding now to move over to the entrepreneurial side and founding a company?
So I was diagnosed in 21 with stage 4 prostate cancer. So I was working at Varian on the oncology side. Good thing is I was working for a cancer company. So I was able to tell people, get people's feedback and guidance on what I wanted to do. When I went through treatment, and if you want me to move them.
It's okay. No, it's okay.
And so when I went through treatment, one of the things that really stood out to me was there was a lot of people choosing to either delay treatment or not do treatment because they didn't have the non-clinical support at home to get them through their journey, right? So when the 20 years before that I'd been in healthcare, our philosophy was always build the best drug, build the best equipment, build the best technology, because the person that's being treated could be your mother, father, brother, sister, uncle, aunt, so you want to do right by them, right? But when I was diagnosed and went through treatment, I started seeing a lot of these people choosing to either not do treatment or delay treatment because they didn't have the non-clinical support at home to get them through their journey. Right? I'd meet patients who had a sick child at home, nobody watched the kid, would end up missing their appointment. Or we would take the bus from their house to the hospital, the bus wouldn't show up for whatever reason, didn't have money for Uber or Lyft, would end up missing their appointment, right? Or would not be taking their meds because they didn't have money to pay for food, right? And so for me, the kind of light bulb moment went off that said, listen, you can build the best drugs, the best equipment, the best services you want. But if your mother, father, brother, sister, uncle, aunt can't get to the hospital to be treated, none of that stuff matters, right? And so a lot of the people I know were building solutions to focus on the clinical side of care. And what I really started thinking about was like, there's all these non-clinical challenges that patients face that affect compliance, affect adherence to treatment, that if not addressed, have negative impacts on outcomes. And so what do you really do to help address those challenges that patients face, right? And I started talking to patients when I was at the hospital and just asking everybody, like, what are you struggling with? What are you doing? And I think the common thread that ran across everybody that I talked to was, we need help. And I use we because I'll include myself. But we don't want to ask our friends and family to help us, right? I don't want to ask AJ to help me because you're busy with your life and your family. You've got work to do. I don't want to put you in a position to say no to me. I don't want to be a burden on somebody else. So patients as a whole tend not to want to ask for help. Flip side is you've got a lot of people who care about the patient who want to help, but don't know what the patient needs, right? And so how do you kind of bridge this gap between the patient being willing to ask and being comfortable asking and giving visibility to what people who care about them know about them so they can help the patient? So I started just thinking about that problem. And I started saying, I believe God gave me cancer for a reason. And if there's a way for me to take that diagnosis and do something meaningful to patients, not just cancer patients, but any patient dealing with a chronic disease, asking for help is not cancer specific. Asking for help is disease agnostic. And so if you can build a platform that really makes it okay for somebody to ask, makes it easy for those that want to help to know what the patient needs help with, not only do I think you can help people overcome some of these non-clinical challenges they face that they need to kind of solve as they go through their patient journey, but you can also generate some really interesting data that hospitals, health systems, pharma companies, payers can look at and say, can we tease out what the biggest non-clinical risk factors are for our patient population so we can provide the right services at the right time to the right patient, so we can remove some of these needs, right? So we know, for example, that patients who live in the Central Valley of California need help with childcare and housekeeping, whereas patients who live in San Francisco need help with transportation. Can we as a health system provide different resources in those two areas so that the patients who live in the areas where they need the help get the right help that they need, right? And so that's kind of why we started WiTT, and that's kind of my light bulb moment that says let's focus on the non-clinical challenges that patients face.
Yeah. I would love to understand what your first person experience was in the moment when you're diagnosed with cancer, you're going through these treatments and you're making these observations. And then on top of that, if at least if I heard correctly, still on the inside, having some resistance, wanting to ask for certain needs that you may have had. Can you just take me through your experience in the first person?
I think the one thing that I noticed when, was, the one thing I noticed was, but for the grace of God, we have what we have, right? We have the resources. We're never going to struggle with, can I get to the hospital on time? Do I, can I afford to pay for food and my meds at the same time? But I also learned that we're the exception, we're not the rule, right? There's more people out there who don't have what we have, and who struggle with day-to-day stuff, right? $25, $50 for groceries is a lot more meaningful to a lot more people than it is to people like us who have resources, who have connections, who have friends, and so on and so forth, right? And so part of the challenge was not just you as a person or me as a person not needing financial support. I didn't need money to kind of get me through my journey. I need somebody to go for a walk with me. I needed somebody to keep me company at the gym. I needed somebody to kind of just talk to. And I worked for a cancer company. I had enough people in the company who would have happily come and done stuff for me if I had just asked them to do it for me. I didn't ask for the simple reason that I didn't want to bother anybody. I'm like, you know what? It's the middle of COVID. I don't want to. You all are dealing with your own issues. I don't want to be able to ask you something and put you in a position to where you may say yes. You may want to say no, but you don't know how to say no because I'm asking you. And so I really started thinking about how do you kind of just destigmatize this asking problem, not just for me who didn't need financial support, but It's easier to ask for somebody to go for a walk with them than it is to say, I need $50 for groceries, or I need money to pay for childcare, or I need money to pay for my mortgage or my rent. And all those challenges that patients face are challenges that they face internally by themselves, and they out of pride or out of whatever else, they don't want to share it. And so my big focus was like, how do you make it okay to ask without the guilt of asking, recognizing that asking for help is not putting a burden on somebody else, but it's actually giving somebody else a gift and an opportunity to do something for you, and to kind of flip that switch in every patient's mind, whether you're a cancer patient or a diabetes patient or a CHF patient or a COPD patient, to be able to say asking for help is not a negative. It's actually giving someone who cares about you the gift of doing something for you that they want to do, not because you're asking them to do it for you, right? And so for me, it was just like recognizing that, but for the grace of God, I was born where I was. I kind of went through my life the way I did. I have what I have. But there's more people out there who aren't like us. And those are the people that I feel, if I'm going to do something meaningful with my life and have an impact, let's try and move the needle for the rest of the population that, doesn't have what we have.
I would love to know what WiTT stands for.
So WiTT stands for We're in this together. And I have to give my daughter credit for that, because we were driving back from my brother's house after one of my treatment sessions. And I was telling her I was thinking about a company and starting a company to help patients. And she goes, why don't you call it WiTT? And I'm like, there's nothing funny about cancer or helping people in need. She goes, no, WiTT. I said, what does that stand for? She goes, we're in this together. And so I have to give her credit for that. But, it does emulate what we're trying to do, where I think any patient going through treatment or going through their own challenge, whether it's cancer or diabetes or COPD or any other chronic disease, you need a village to support the patient, whether the patient has a village around them, or you rally the community around them, or you rally church group members or friends and family or neighbors or whoever else it is, right? A lot of patients need support to kind of get through their journey. And if we can all rally together to do that, I think we can really make a difference and move the needle for a lot of people who just are out there and need help, but, for whatever reason, aren't comfortable asking. And, the fundamental thing we're trying to do is change behavior to say, listen, it's okay. Asking for help is not any reflection on who you are or how you do. A lot of people need help irrespective of the situation they're in, because you don't know what someone's, dealing with or going through as they go through their patient journey.
And if I understand correctly, your daughter had a little bit more of an impactful role in the creation of the company as well, if I understand correctly, beyond just help with the name.
Yeah,
she kind of pushed you to.
When I was going through treatment, I was talking to her, and I just kept talking about the patients I was meeting at the hospital and what I was doing. And she was 15 at the time. And one day she looked at me and said, if you're so concerned about patients, why don't you quit your job and do something to help patients? And it took me a while to kind of process that, because at 15-year-old, I wasn't sure if she was being snide or if she was being serious about what she was saying. But I thought about it. I'm like, she's right. If I don't do it now, when am I going to do it? Right. And so I quit my job at Varian in 2021 and started WiTT while I was finishing treatment. And with the whole idea saying, if I don't step out of my comfort zone, and I've never started a company on my own before. I've always been part of early stage startups where employee number 6, employee number 7, employee number 5. Never like from day one incorporation documents and getting the company set up and started, and dealing with all the basic building blocks of raising money and starting a company from scratch. And I said, if I don't do it, when am I going to do it, right? And I've got a perfect story to tell, because it's my story. I've seen this happen with other patients. I've lived it. It's not something that is, theoretical concept for me. It's something that I've actually gone through, and I've met people who've gone through the same thing. And so let's try and do something that's actually meaningful, and use this as a way for me to kind of leave a legacy and give back to others that, for no fault of their own, need support as they go through life.
That's beautiful. I love that story. And so you mentioned you're trying to change behavior, right? Because as you mentioned, the whole key to a patient receiving help is being open to receiving that help, being open to ask, right? Not being afraid to ask. So therefore, the individuals who are willing to help have the opportunity to do so.
Yep.
What's the insight that you have from your own experience or from your conversations with other patients that powers your approach to solving that problem with WiTT in the platform that you're building?
So the biggest thing I learned was like people don't like to ask other people directly to help them, right? I mean, we don't want to be a burden on somebody else, and that's true for any asking for help for anything you do is just people think twice or thrice before they do it, right? But when I was going through treatment, I had a friend of mine who was getting married and sends me a link to his wedding registry, and I look at his wedding registry and he's got stuff on it. And I'm like, why are you even asking for this stuff, right? And so I called him and said, why, don't you feel guilty about asking for stuff that I know you're never going to use? And he goes, no, because I saw it. I thought it was nice. I'm not asking you to buy it for me. I'm just saying, here's what I have. And so I thought, if you're not feeling guilty about asking for stuff that I know you're never going to use, that you're never going to think about, and there's no guilt for you asking for stuff that is not cheap, right? Why can't I take that same idea and apply it to patients? So why can't we create take the best of the wedding registry idea and create a support registry for patients, where you as a patient now just ask for what you need. You're not asking AJ or Rahul or anybody else to buy you something. You're saying, listen, this is all the things I need help with. And then combine that with the best of crowdsourcing and allow people who care about you visibility into what you need help with, right? So on the one hand, you as a patient can ask for whatever you want without the guilt of asking, because you're not asking a certain person to do something for you. You're saying, here's all the things I need help with. You can then share that with everybody who is in your network, whether they're friends, family, work colleagues, church group members, your neighborhood people. Take the best of social media, and then build an innovative fintech platform on the back end to really give people who don't have access to services like Uber, Lyft, DoorDash, Instacart, and other things that we take for granted, a financial vehicle in which they can actually do that. And so if you can combine those three things, the wedding registry, crowdsourcing, and fintech, and put it together, not only do I think you can actually break this barrier of making it okay to ask, but I think you can generate some really interesting data that organizations can use to really think about how do you drive the right insights into what your patients need help with.
Good.
Right? And the data, I think, is just as valuable as anything else that we can generate, because it gives organizations insights into how do we target our specific patient populations with the specific needs that they need help with, so that we can provide the right services to the right patients at the right time, and then go from there.
So how do patients access the platform?
So when we first started the company, we were looking at a B2C company, and we decided to kind of like build our own platform and people can go on our website, wittforever.com, and sign up and go from there. But we realized the best way to have the biggest impact is not to build our own brand. Patients trust the organizations they work with, right, or they're being treated at. And so what we moved to is building a platform where we could actually white label the platform for organizations. So we could go to a Stanford, we could go to a Baptist Health, we could go to a Proton Center, and say, listen, your patients trust you because they're being treated at your organization. This can be a valuable resource for them to get the support that they need. We will white label it, skin it with your branding, come up with your logo design, and make it your product that you can give to your patients. And that way, not only do you get a greater buy-in from patients because it's coming from a trusted source, but you also get people who are giving to trust the platform more because it's being hosted by a trusted source. And so you kind of solve that problem of not having to build our own brand and figure out, I don't care if nobody hears about WiTT, I care about how many people we're helping. And if we can kind of work with organizations to say, let's take this platform and really think about how we can have the biggest impact so you can meet the patient where the patient is, and not just in the four walls of the hospital. I think you can create an ecosystem of giving and ecosystem of support that not only directly helps patients, but also helps the organization and the hospitals, because you can have more patients complying with treatment, more people adhering to medication, which hopefully will then lead to better outcomes.
Absolutely. So as a patient, you come in for treatment, let's say at Stanford then presents you with this resource. It's white labeled, so it's their branding and saying, hey, we have this resource where you can create this support registry, and then share that with your network for people to be able to contribute.
So Stanford is not a customer of ours to kind of
for example,
but like Miami Cancer Institute, which is part of Baptist Health, or New York Proton Center, which is a proton center in New York. Exactly. Customers show up, patients show up. Social workers tell them about the platform. They go in and sign up on the New York Proton Center website. New York Proton Center donors can go in and support patients. We can go into their website and support their patients. And you kind of really get some really interesting insights into what do women with HER2 positive breast cancer need, and how is that needs different from men who have prostate cancer, or how is it different from pediatric patients, and so on and so forth. So you can really start teasing out differences and using that insights to really target how you engage with patients, what services you offer to patients, what resources you share with patients, right? If there's you see a lot of your patients having food insecurities, right? Maybe there's local food banks that you can connect them to and partner with that can address some of those needs, right? Or, if you need transportation support, how do you partner with Uber and Lyft to kind of get the right rides, or use your volunteer population to provide rides to patients like ACS has for what they do, right? And so I think there's different ways to really tease out what are people really struggling with, because they're telling you. It's not a survey you're generating. They're asking for stuff like you would in a wedding registry. And you can use that insight to really start thinking about how do I know what, Rahul's coming in for treatment tomorrow. He said he's struggling with transportation. Let me call him up and see if he needs a ride, to make sure he gets here on time and doesn't struggle with, I don't have a ride, so I'm going to miss my appointment tomorrow. Right. So I think there's ways you can really think through how you use that data to help patients get the support they need, all of which affects outcomes, eventually. And it doesn't do with the clinical side of care.
Okay. And then, so when it comes to the peripheral data, I guess, like you said, for example, woman or female, 30, going through, breast cancer treatment, this is what she's asking for. Is it just is the peripheral data or the contextual data just the information that the health system or the network has based on their medical record history, or is this including socioeconomic data, things of that sort, that would provide some more granular data and insights to the healthcare system?
So we don't interface with any hospital EMR or EHR,
Okay.
right? So none of the stuff we have on our platform is clinical data or hospital-specific EMR, EHR data.
Okay.
Everything we do is on the SDOH and the social economics, social determinants of health side, right? And everything is self-reported by the patient. So we tease out, like, truly focused on the health equity and access to care pieces. What are people struggling with that have nothing to do with the clinical side of care? I'm less concerned about whether someone has the right treatment as I am about whether someone has the right resources to get to treatment, to be focused, right? And for that, whether it's housing insecurities or food insecurities or transportation insecurities, or I've had patients call me up and say they need help because they used all their money for their own medication, don't have money to buy their kids birthday presents, right? And all those things while it may seem non-compelling to us as far as how that affects treatment, mental health is a big part of somebody's success in treatment. When I went through treatment, half of succeeding through treatment, how you get through it, is how strong you are mentally through it, right? And if you're struggling, if you're stressing out about, I can't feed my kids, or my kid's going to school with the same clothes he wore last year because I don't have any money to buy him new clothes for this school year because I used all the money to pay for my meds, or my daughter just passed away, I don't have money for funeral expenses to pay for the funeral. Those are all things that people shouldn't have to deal with as they're dealing with, how do I just focus on my health and how do I focus on getting treated, right? And so our focus at WiTT is really around how do you help patients and give visibility to all these non-clinical challenges they face that are just as important to their overall health, because if they're focusing on those things, they're not focusing on what's most important, which is their health, right? And so we can address those issues even in a small way. You can make a difference to just what their journey is like as they go through treatment.
Absolutely. And you mentioned when you were going through treatment, fortunately, you were in a situation where a lot of your non-clinical needs were not financial related, right? You were looking for people to go on walks with, work out with, potentially more, emotional support in that regard than financial support. Based on the patients that are on your platform at the moment and what you all are observing, how much does non-financial needs represent, or what's the share of non-financial needs that
Yeah, I mean,
are showing up at the moment?
I think right now we've got about 2,000 patients on the platform. We've been fairly cautious on how fast we grow because we want to make sure we do it right. We've got about 2,000 patients, about 25,000 of needs that have been expressed. I would say,
Are those unique needs, by the way? I'm sorry.
yeah.
Okay.
So like all unique needs for each patient.
Okay.
I would say 90% are financial, 10% are non-financial. Now, that's also a reflection of the patient population we have. So we've got a lot of patients who are underserved, underrepresented, who I would call in financial distress. So you'd expect a large percentage of those patients to have financial needs versus non-financial. But we are seeing, and we're trying to, we've been careful to, there's a lot of work we still have to do to make the platform more engaging for patients. We've also, a lot of the, financial needs you can share with anyone, right? Whether it's somebody you know or don't know, when you're asking for money, gives you money, doesn't matter. But when you ask someone to pick up your kids from school, it does matter who does that. So we have in the platform itself, only the people that somebody has invited to support them get visibility to the non-financial needs, because you don't want a random person showing up to pick up your kids. You don't want a random person showing up to go for a walk with you. You want it to be somebody you know or somebody you trust to do that, right? And so by default, because a lot of our patients are underserved, underrepresented, don't have big networks of people to support them, getting these non-financial needs met, the non-financial needs met by friends and family who you may or may not have, has been a challenge. But we're starting to talk to health systems and others who have volunteer populations, right? Have staff who want to help. And how do we make those needs visible to a trusted resource within the organization to say, if I live in the Bay Area and I work for a hospital that we have this platform that we're giving to our patients, if you can show my staff and me where patients need non-financial support, somebody to take the garbage cans out, somebody to mow their lawn, somebody to clean their gutters. And if I know that person is on my way into work or is in my neighborhood, I'm a hospital employee, if the patient's okay with me showing up and doing that for them, I'm a trusted resource. I'm not somebody who's a random person showing up and helping them. So there's ways that we're thinking about we haven't done it yet, but there's ways we're thinking about it. How do you expand the network of people that can provide services that are non-financial nature without potentially risking the patient in terms of, and there's certain things we won't let somebody you don't know do. And there's certain things, if somebody wants to take my garbage cans out, I never need to meet them, don't care. But if somebody wants to go pick up my kid, it's somebody that I need to know, that I trust, and my kids trust, so we can have that. So we're still kind of teasing out some of those nuances of how do you build the right trust factors into the platform so that some of those non-financial needs get met. But, a lot of people have money to give and they can happy to give. A lot of people don't have money to give, but have time to give, right? So let people decide what they want to do and how they want to do it. Ultimately, I do believe it takes a village to build. And, we've believed in this community engagement philosophy because I think you can mobilize local communities to support local patients in their areas. Because I think by and large, most people want to help others. It's just they don't know how to do it and what to do. So if that answers your question.
Yeah, that's great. That's great. And I guess it leads me to a thought about the financial side of things. Given that there is such a large need on the financial side of things, currently in the platform's current iteration, is there functionality for like recurring payments or recurring asks, things of that sort? So how does that work?
So patients can ask for recurring asks.
Okay.
Patients can say, I need a transportation, I need an Uber ride every week to the hospital, every day to the hospital, right? And they can kind of make recurring requests as well. One of the things that we do differently than other platforms is 100% of what's given to the patient goes to the patient, right? So when I was going through treatment, I went on to other platforms that I've given, and most of those platforms would take a percentage off and then give the patient the net amount. And I'm like, listen, if a patient needs $50 for groceries and you give them $40 for groceries, you're defeating the purpose, right? So we strongly believe that if someone's asking for 50 and you as a donor give them 50, we shouldn't be taking anything off that. Like if you're giving somebody out of the goodness of your heart X amount, that patient who's receiving it should receive the entire X amount, right? So we're very careful to make sure that we have other ways to generate revenue and other ways to generate, cash flow into the company where we don't take it out of the patient. And we really want to focus on making sure that we do right by the patient, because the patient is the center of everything we do, right? We want to make sure that we are as holistic as we can with every patient that we talk to and every patient that uses the platform. And so it also is easier for giving, because donors now know that if I'm giving $100 to somebody, I know that that person is getting the entire $100. They're not getting, 85 or 90. And I think that level of trust, I think as we kind of expand that story and tell our story more frequently, will allow donors to be more comfortable to give, because they're giving to people who are, getting everything they give. And when, one of the things we've done differently is, before a patient can make their profile public on our platform, we actually verify that they're actually a real patient, right? So we want to avoid this issue of how do I know whether this person who's asking for funds is actually a real patient or not? And so we've actually built a verification process into our platform that says, hey, if you can go to our platform and you want to give to a patient and you see a name of a patient, that patient has been verified by someone on our platform as a real patient going through treatment at the facility that they say they're being treated at, right? So we've got some level of comfort that donors can trust they're giving to somebody actually in need, and who's actually going through treatment.
Okay, excellent. And so just to kind of, I guess, crystallize everything in that regard, if I was to, for example, be a patient on the platform and let's say I need a $50 ride Uber every week, and I send it out, my friend can go on the platform and they will have a recurring charge that they can, is that how it works? For example, I can go on and say, okay, I want to take care of that. But
so if you go on the platform and you ask for, so let me kind of caveat that by saying two things. One is anyone can sign up and use the platform, right? So even if you don't have a disease or you can sign up and use the platform and invite your friends and family to support you. What we caveat by saying is if you want other people to see to support you as well, you need to be a patient being treated somewhere, right? So on the one hand, anybody can use the platform and you can use your friends and family, because I don't, who's to say that people who just need help can't use the platform and get support from their friends and family. But if a patient says, I want recurring needs, right? A donor can go in and select multiple items to give. So let's say you say I need a ride every week for the next 5 weeks. I can go in and say, I'm going to select 5 of those items that you've selected. So it shows up as 5 separate asks on the platform. So I can select all 5. The reason we don't want to have a recurring to a patient is what if a patient has 3 asks and, you've filled those 3 asks, but then if you give recurring money, the patient doesn't have any needs they want to fill. So we tag dollars to asks, not to a patient, right? So we say, if you as a patient need help, put what you need help with out there and let somebody claim it. Like you can't give someone who has a wedding registry, just kind of randomly give them money. You take items off the registry that you do. So the same concept we apply to patients and say, if you have things on your registry, people can claim those items off of it, but they can only claim off of it what you have listed, right? We have a 501c3 as part of what we do. So we have a nonprofit arm of what we do. And so somebody can go to the nonprofit and say, I want to give the nonprofit $100 every month. And you as a nonprofit then take that money and distribute it however you want to people in need. But I want to be able to support the cause and I want to be able to support patients. So that you can do from a recurring perspective, but you can't support patients directly from a recurring perspective, because you need to understand, you can only support needs of a patient, not just randomly give people money for the sake of giving them money.
Understood. Thank you for that clarification.
Yeah. No.
And I guess I'm interested on the donor side now, like the donor psychology, because we talked a lot about the patient psychology, the barriers to receiving help, the fear of asking for help being a burden, things of that sort. And I agree that if you can remove that fear, remove that barrier to asking for help, it increases your likelihood of receiving support in return. But then I turned to the donor side of things, and I'm curious to get your thoughts on the donor psychology, right? And the incentives on that side, where, um, in most cases, right, we have more needs than people are willing to fulfill, and so, um, what do you think will motivate individuals on the donor side to, uh, in a consistent manner, or in a reliable, way, fulfill the needs
Yeah.
of these patients on your platform?
I think there's a couple of things. One is, anybody they see on the platform has been verified as a real patient going through treatment. So I think it removes some of the uncertainty of am I giving it to somebody who actually um, is in treatment, right, or needs help, right? Um, Second is, that 100% of what you give goes to the patient, and so there is this level of like, if I'm claiming an item, you can give as little as $10, which is a minimum donation to somebody, or you can give as much as whatever they're asking for. So if somebody says I need $100 amount for groceries, like, and you give them $10, all $10 go to the patient, but then the patient's registry item will change from 100 to 90. So the next person that comes in is not giving 100, is giving like, the balance is 90. So let me give whatever percentage of that 90 I can give. I also think there's we're doing some interesting things right now. One of our investors is a group called Lead out of Orlando that has a big connection with NBA and NFL teams in the country, and a lot of the sports teams want to do something for their community, and a lot of them are affiliated with local health systems in the community. And so our feeling going into 2025 is if we can start partnering with NBA teams to support patients in the local community, people who go to games, people who are treated at the local health systems are more likely to give to support people within their own network. And so think about, going to the Warriors game, for example, and saying halftime, have a QR code that says, hey, we're doing a drive to generate X amount of money for patients that live in the Bay Area. And if you can start looking at micro donations coming in, you don't have to give $100 and $200. You can give $5, $10, like all this, and 10,000 people giving $5 adds up to where you can now all of a sudden help a lot of people in the community that need $300 for grocery, for transportation or childcare or whatever else. Every small bit helps. And so the whole philosophy for us is, can you rally the community in which the health system is, in which the patients are, to really support people in their community, right? My vision is like having hubs like this all over the country. So it's not a national platform. It's like, we're targeting Houston, we're targeting Dallas, we're targeting Orlando, Miami, and health systems and sports teams in that community rally the people around them to say, these people who are being treated, who are struggling with childcare or food insecurities, whatever else, are the ones who go and buy from you, who go shop in your store, who are your neighbors, right? And let's rally our group around supporting local efforts. And I think that's how you really get donors to really drive and support, whether they're in the community or, I want to know someone like me who had prostate cancer, and I want to support other men who have prostate cancer, right? And so I think there's ways to really engage the donors in a way that it's more than just saying, hey, give me a amount of money because I'm believe in my cause. It's, don't give me money. Give it to you, Joe Smith, who lives down the street from you, who says they need $75 to go take their kid for treatment and pay for his medication, right? So I think that ecosystem, if we can really focus on harmonizing that ecosystem, I think you can mobilize a lot of people who will actually want to support people locally.
And is there a financial incentive for them to donate, similar to any donation to a 501c3 being, for example, a tax write-off or anything like that?
So if they give it to our fund, or to our, so when we build a white label for organizations, we can set it up so that they can give to the hospital's 501c3 as well. So if they give it to a 501c3 fund, then that's a tax deductible donation.
Okay.
Right? If they give it directly to a patient, then that's not tax deductible because the patient's not a 501c3, so you can't write it off. So you can either give it. Some people just want to give directly to a patient. I know, the story that I'm reading is someone I want to help. She wants $25 for an Uber ride. I want to give it to her. Don't get a tax write-off. But if you say, listen, I want to give money to your foundation whether it's our foundation or whether it's the hospital's foundation, in that case, it can be a tax write-off to the organization, to the person giving.
Okay, excellent. Yeah, because I was curious about the micro donations and whether or not, hey, if I take care of these Uber rides,
my thing is, if you give $5 to a platform, if you give $5 to the, however money you give, if you give it to the foundation, you can claim a tax write-off. If you're giving $10 to a patient directly, do you really care if you want a tax write-off or not?
Right.
Some people may, some people may not. So when it goes directly to a patient, though, it's not a tax deductible event. If it goes to the foundation, then it is, because you're giving it to a 501c3 that then can use that money to distribute it to other patients.
I see, and you have it set up so they can choose.
And we can when we set up our white labels for organizations, we can set it up to where donors can contribute directly to the patients as part of the organization, or to the organization's 501c3 foundation, and then the foundation can decide how they want to disperse those funds to patients.
I see. And is there a policy in place for the latter? For example, if the institution or the organization's fund receives, X amount of dollars, through the WiTT Forever white label, how do they distribute that to the patients? Is it at their discretion?
It's up to them. I mean, every hospital has different guidelines and different charter agreements on how they give money, how they want to be equitable. I mean, the constant theme I'm seeing is like, how do you drive health equity and access to care? And, depending, one hospital may be in an area where there's a large, at-risk population. Their philosophy of giving may be very different than a hospital that is in an affluent neighborhood that, has only a smaller percentage of people that are, at risk or, underserved or underrepresented. So we don't provide guidelines. We can enhance the platform to accommodate what the requirements are for the health system as they decide how they want to distribute funds, but the policies in which they distribute and how they want to distribute to patients is completely up to them.
Okay, excellent. And then now diving a little bit deeper into the data side of things, between your platform and the health system.
Yeah.
Obviously, like you said, 25,000 unique asks or needs from patients currently on the platform. What infrastructure is in place on the organizational side of things to have actionable takeaways from the insights and data that you're providing through the platform?
Yeah, so the reason we've built the platform, and I'll answer that question in two parts. One is the way we've built the platform. The reason we don't do interface or integration with hospital EMRs, EHRs, is it keeps the platform cleaner from the hospital. So we don't need hospital IT, we don't need hospital compliance to get involved, because we're not sharing PHI back and forth between us and the hospital. So it's a very clean standalone. It's similar to a hospital saying we want to create our own Facebook page for our patients, right? So we've kind of contained the product and the white label as a very clean and non-intrusive platform. So we don't have to spend time dealing with hospital IT, hospital compliance, hospital security, about data flow back and forth, right? We create dashboards for the hospital staff on how they can access and mine their data. I mean, ultimately, their patient data is their patient data, so they own the data. But we can provide insights and guidance on how they want to see the information, and then how they want to use it to be actionable to go forward. So can you, for example, identify, look at your EMR and identify which patients are coming in tomorrow, then look at our data set and say, what does AJ, who's coming in next week, say he needs help with? And if he needs help with things that you can address that may prevent him from coming in next week, your social worker, case manager, nurse navigator can reach out to the patient and say, you know what, I noticed that you said you need help with transportation. We have a free ride service that we can offer you, or let's use our foundation to give you order an override for you to bring you to the hospital. Right? So you can tease out and identify proactively what are the biggest compliance challenges that a patient may have coming in. We've got 5 customers right now, but we're looking for strategic partners where we can say, listen, we don't have all the answers, right? We've built this over the last year and a half. We're still fairly young. There's a lot of really interesting data that nobody else is generating. I think what we have is a unique data set that is targeted towards SDOH that doesn't exist in EMR, doesn't exist in in an EHR. And so we're looking for partners that can say, okay, how do we take this data that we're generating and truly make it actionable for you and your staff, depending on the different roles you have in an organization? And so finding the right strategic partners to say, we would love to be able to capture this data set as well. So far you're capturing A, B, and C. We'd love to capture E, F, and G. We can build that into the platform. And then you work with them to say, okay, how do we take this data now and allow your staff, allow your social workers, allow your case managers, allow your clinicians to better understand the patient so you can actually treat the whole patient and not just the disease that they have, right? Because a lot of the non-clinical stuff does weigh in on eventual outcomes, because if a patient's not taking their meds because I'm using my meds to pay for food insecurities for my family, right? That's an issue, right? 38% of cancer patients don't take meds or don't go to the pharmacy to fill prescriptions because they need that money for other uses, right? And so if you can help tease out those nuances, you can give organizations this rich data set to really understand, not to sound callous, but these are the patients that also cost the health systems a lot of money, right? Because they're the ones, if they don't take their meds, they show up or they don't follow through on appointments, they're the ones that show up in the ER, right? They're the ones who have missed appointments, who cost the hospital resources because the patient doesn't show up. And so if you can proactively identify those risks and get the patient to the hospital, there's a revenue impact, there's a cost impact, and there's an outcomes impact that you can identify and address just by having a line of sight into what patients need.
Absolutely. Great. And I mean, I love what you're building, Rahul, to be honest.
I like to say, I believe God gave me cancer for a reason.
Yeah,
right?
yeah, absolutely.
This is my opportunity to kind of say, okay, you know what? Don't sit back and say, woe is me, I got cancer now, let me suck it up. It's like, okay, I've got cancer for a reason. You gave it to me for a reason.
Mm-hmm.
Let me do something meaningful with it. And if we can even help one person have a somewhat better journey through their journey, we've done our job. My hope is that enough health systems, enough pharma companies, enough payers look at what we're doing and say, how do we take this platform, help them build it so that we can actually move the needle for a vast majority of patients out there. I mean, 3.6 million, I mean, more than that right now, but I read somewhere 3.6 million patients miss appointments because of transportation issues, right? That's a lot of people you can help.
Absolutely.
Just by identifying that these are the people that need help with transportation.
Absolutely.
Right. So I think there's a lot of things we can do. And, what I'm looking for is like, how do we surround ourselves with the right people who want to have social impact, want to make a difference, and ultimately, help those that, for no fault of their own, don't have the resources we have.
Absolutely. I'm curious about any other additional stakeholders that you're working with or adding value to as a result of the platform and what you're building. And if so, what's the value that you're driving more broadly in the ecosystem for all stakeholders involved?
Yeah. So I'll start with the patient, because the patient is at the center of everything we do. Value for the patient is just getting the support they need as they go through their journey, right? Making it easy making it okay for them to ask for the help they need, making the needs visible to those that want to help, and really destigmatizing and making them feel like it's okay to really be vulnerable, if you will, right? And so that's kind of a goal for patients. And if you can do that, you can rally a community around them to support them. I think for providers, what you do is you really get access to data and you really get access to insights on what your patients need help with and how you can provide the right services to the right patients at the right time. Not only meeting the patient where the patient is, but also impacting your bottom line from a revenue and a cost perspective, because less missed appointments, more adherence treatment has a revenue impact to the organization. It also allows you to be more effective with how you allocate resources. So from a cost perspective, you can be much more cost efficient in terms of resource allocation. And you end up hopefully getting better outcomes for patients, because now patients are more compliant and adherent to treatment. From the payer perspective, it gives you insights into what are the biggest non-clinical risk factors for different patient populations. So if you think about health and wellness, or you think about proactive care, and you think about driving down the cost of care delivery, if you can identify and tease out what different patient populations in different regions or demographics are struggling with, you can actually put programs in place to incentivize the right behaviors and provide the right resources to really drive down the cost of overall care for them. And then the last is, if you think about pharma companies and clinical trials, a big part of why pharma companies struggle with retention on trials is because a lot of the patients who sign up for clinical trials drop out, not because the trial itself is bad, but because they don't have the social economic non-clinical support they need as they go through their treatment. So if you can identify not just what those patients need help with, you can actually use that insights to create the right protocol design when you do your clinical trials. But also, once a patient's on a trial, you have a mechanism now in which you can actually support patients and remove some of these non-clinical barriers so that they actually stay on the trial and you can drive it, right? So there's, and then hospital foundations, usually raise a lot of money, and most of them struggle with how do we distribute that money directly back to patients. And so we not only give them insights into what the patients need, but also a mechanism in which they can actually support the patients directly, right? So we think our platform itself has value to patients, has value to donors who are supporting patients so they can support them directly, has value to health systems and the health systems foundations. We can impact payers, we can impact pharma companies. And so I think as we grow the company, I think our use case and our impact we can have to those different stakeholders ultimately come down to what can they all do to really make the journey of the patient much more seamless and much more risky to the patient, which I hope eventually will get better outcomes.
Can you tell me a little bit about the broader vision? Because I think you successfully helped one person at this point, right? You have 2,000
We've helped more.
Yeah, I think you met that. You met that requirement, right? So now that you've accomplished that goal,
yep,
and you continue to accomplish that goal, what's the larger vision for you? How do you see healthcare changing, health equity changing as a result of
I don't want us to
what you're building?
I don't want health equity to be a conversation, right? I don't want access to care to be an issue, right? My whole wish is if we can rally the communities to help people in need, forget any person with any chronic disease. Can we really remove the need to talk about health equity or access to care? We shouldn't, just because somebody is living in East Palo Alto and not in Palo Alto, access to treatment and access to basic necessities of life shouldn't be a differentiator between the two, right? And so for me I believe there's enough good in people to rally communities around those that are less fortunate than us, who are struggling with clinical issues, right? It's like, whether it's mental health, whether it's cancer, whether it's, other chronic diseases, and just remove even some of the burden that they have. I'm not saying you have to remove all of it, right? But if you remove 10%, 15% of that burden that somebody has, they can spend that 15% focusing on what is important, which is their health, which right now, a lot of them aren't doing. Right. So my ultimate goal, 3-5 years, is I'd love to be able to help 1 million people a month on the platform, and really start chipping away at this. And there's a lot of good nonprofits out there doing a lot of great work to help a lot of people. And, I think it takes a village to kind of do that. I think we're all doing it in different ways. We're not a nonprofit, we're a for-profit. We believe we have a successful business that we can build, but I think we're doing things in a very different way than traditional nonprofits are doing. Where I think if you can rally this micro donations around the community engagement to support people in your community to really drive change, my vision is we're not talking 5 years from now about health equity or access to care, because it's like everybody has, we've created this ecosystem of giving now, right? And support, and we're generating all this data that, you can know proactively that, hey, if you're diagnosed, and my vision is like, if I'm diagnosed as a patient with prostate cancer, my social worker says to me, do you have a pet? Yes, I do. Well, people like you who are your age with your diagnosis, with your disease, have needed help with pet care. So we're going to connect you with a local pet company that's going to help you support your pet while you're going through treatment. And just there's a lot of things you can do. You know, if you're a woman with breast cancer, you know, you're going to need a cooling cap for, you know, and so let's connect you with companies that can do cooling. I mean, there's so many things you can do proactively that you just kind of lift up everybody from an access to care and a health equity perspective. That to me is like, you know, if my cancer diagnosis can help me get that to that point, I'm good.
Excellent. Well, Raul, I feel incredibly honored and privileged to have the chance to work
Feeling
with
is
you and
mutual.
support you. Yeah, and I really appreciate you taking the time to speak with me today. Your testimony is powerful, and the work that you're doing is extremely impactful. And I'm looking forward to seeing you build out that vision moving forward.
Hey, you and me and 100,000 other people, we can change the world.